A few days ago, Elon Musk, who's running the blitzkrieg against the US government for Donald Trump, acknowledged that he had made a mistake, that in going after USAID, the foreign assistance program that he has basically destroyed, he ended up ending the Ebola prevention project that it runs overseas. But he said, have no fear. As soon as we recognized this mistake, we got everything fixed and there was no interruption in service here.
With USAID, one of the things we accidentally canceled very briefly was Ebola, Ebola prevention. I think we all want Ebola prevention. So we restored the Ebola prevention immediately, and there was no interruption.
Well, we're going to break that down. And we're going to do that with Jeremy Konyndyk. He actually ran the Office of Foreign Disaster Assistance during the bombing years at USAID. And then he came back to work on COVID for USAID during the Biden years. So, Jeremy, let's start with this. What does USAID do to prevent the spread of Ebola and other highly infectious and dangerous diseases overseas?
So you've got two big chunks to that. One is preparedness. You want to have the systems in place at a country level that can respond when an outbreak emerges and also to reduce the likelihood that it emerges. So that is things like laboratory capacity for diagnostics, surveillance, so you can detect things rapidly when they emerge, and treatment and isolation and infection prevention capabilities in your health system so that when people begin showing up sick in a health system, they don't infect health workers, they don't infect other people. So you want to have that kind of baseline in place, and USAID makes those kind of investments along with the CDC in a lot of countries overseas that are prone to novel outbreaks. When you then detect something, as now is underway in Uganda with the Ebola outbreak there, then USAID would normally swing into action with an active response team. So that would mean deploying technical experts to support the Ugandan government, ramping up a lot of supplies. So, for example, providing personal protective equipment to the health system so that they can treat cases safely. A whole range of efforts to ramp up the effort to control the outbreak before it spreads further. Another important element of that is traveler screening. So you'll remember maybe in 2014, there was a big hullabaloo about travelers reaching the United States with Ebola. There's a lot of investment that is normally made in traveler screening to prevent people who are sick from traveling and potentially spreading the disease to other countries.
We should underscore here that, this obviously helps the people in the countries where this is happening, but we also have a bit of a self-interest here in that we don't want it to spread. We don't want it to come to the United States or, turn into a global pandemic as we saw with COVID. So we're doing good for others and for ourselves. And does this entail using USAID workers or working with contractors, partners? Just quickly, just tell me how that goes about.
So typically that would mean deploying some USAID personnel, but then a lot of the frontline work is being done through partner organizations. So providing grants and contracts to aid organizations to support the Ugandan government and run some of their own activities.
So when Elon Musk came in with his minions and shut down USAID and froze, federal foreign assistance, how did that affect this?
So almost none of the things that would routinely happen in a major outbreak actually took place. USAID did not deploy anyone out to Uganda to support the response. They did not get money out to partners quickly. It took them weeks where it would normally take hours and days. And even, the funds that did go out were very, very small. And some of the contracts were then canceled. So one of the awards that was made was to a partner to support traveler screening at Uganda's major airport at Entebbe. That was just canceled last week.
So that means people can get on a plane in Entebbe and fly to London, Frankfurt, New York, wherever, and no one's asking them about Ebola.
It means that the support to the Ugandan government to make sure that that's as robust and airtight as possible is gone. So it's a huge risk.
Elon Musk says everything's been fixed. No,
he has no idea what he's talking about. He is making it up as he goes. He doesn't understand the things he's canceling. He and his team of teenagers and 20-somethings are using AI, as far as we can tell, or keyword search to just decide what to cancel. They're not bothering to stop and understand what they're actually losing when they shut these programs down.
And we're focused here on Ebola, but what does this mean in terms of other diseases and other possible pandemic threats?
One of the things you realize really quickly when you start getting involved with outbreak response is there are outbreaks all over the world all the time. And it's really hard to know at the front end of one which one has the ability to truly explode at a global level. And so it's really important to get on top of all of them very, very quickly before they have a chance to spread. When you lose these capabilities, particularly that preparedness capability I was talking about earlier, when you don't invest in that, then you raise the chances each time that one of those outbreaks is going to spread and get out of control globally.
I read in the newspaper there's something going on. Is it in the Congo, in the Democratic Republic of Congo? 50 people dead from a mysterious illness. What does that mean for us? What does it mean now that the U.S. aid capacity has been severely cut, if not abolished?
So this is really a good and interesting example. This was a mystery for the first 2 weeks. Over the weekend, the World Health Organization came out and said they think now this is due to a water contamination. It's a waterborne illness. So then if that's confirmed, then hopefully that one is not at risk of spread. But we only know that because the World Health Organization was on top of it. Why is WHO on top of it? Well, the section at WHO that does this, their emergencies and outbreaks section, was largely created at the behest and kind of under pressure from the U.S. government after Ebola in 2014. And we are the principal funder of it. The U.S. is now withdrawing from WHO. CDC has been barred from talking to WHO. All of our funding is being pulled out of WHO. So there, too, we're not just kind of taking ourselves out of the game. We're actually weakening the entire global infrastructure that we have built, that we have invested in to keep us safe from these sorts of things.
That doesn't sound very encouraging, I have to say. Let's see if we can end on a somewhat optimistic note.
Yeah.
And that is, would it be possible to restore these capacities if for some reason, mysteriously, a wave of rationality and sanity struck the Trump-Musk team?
It absolutely would. And one of the ironic things here is clearly Musk feels pressure over this. He feels like he needs to reassure the public and reassure the administration that they're not cutting things that are going to create risk for the American people. But of course, they are doing that. He has no idea what to cut and what not to cut. He's just cutting everything by default. There could be a different approach. Congress could intervene and begin to put some parameters around this and kind of assert itself in this process. They haven't really done that yet. But when you look at what's actually been done to USAID, yes, they are beginning the process of canceling contracts. They are trying to push out all the staff. None of that at this point is unsalvageable. It could be pulled back in, as you say, a fit of rationality. But the risk is if we persist on the course we're on now, if we lose all this capability, all of this expertise, it's going to take decades to build back what we are at risk of losing with USAID right now.